Hi, everybody. My name is Dr. Kelli Dunlap. I am the Manager of Mental Health Research and Design at iThrive Games, and I'm really excited to be sharing my talk here on the representation of mental illness in games. So a little bit about myself and my background. I earned my doctorate in clinical psychology, and then immediately after that went into a master's program for game design, like you do, because the intersection of mental health and games is something that I'm super passionate about. A few years ago, there was a big uptick in conversations around diversity in games among game scholars, players, devs, and the industry overall. These conversations about representation focused mainly on gender, race, sexuality, and ability to some extent, all of which are super important to be looking at and analyzing. But it made me wonder about the state of mental health and mental illness representation in games. I quickly discovered that research on representation of mental illness in games is pretty much non-existent, and I could count the number of scholarly works on this topic on one hand. This was really surprising because research on portrayals of mental health in other media, like film and television, is pretty robust and spans over 40 years, but this is not the case for games. The next thing I discovered was really surprising to me, that mental illness is actually really common in games. So according to available research, about 25% of games portray a mentally ill character. So that's about 1 in 4. And by comparison, in the United States, mental illness is roughly about 20% of the population, or 1 in 5. So mental illness is more common in video games than it is in real life. And so I began to wonder, since mental illness is so common in video games, what are those representations saying, and what are those characters portraying? Mass media, including TV, film, and games, is the public's primary source of information about mental health. Because mental illness is stigmatized and talking about mental health issues is still considered taboo, media portrayals are frequently the only reference point people have for what mental illness looks like. Imagine if the only exposure you had to, say, the opposite sex was what you saw on TV. It would be a very different experience than what is actually the case. And this is probably why 30% of Americans still think that mental illness is a sign of bad character, and why 46% of Americans think that someone with a mental illness is much more likely to be dangerous than a person in the general population, even though a person with a mental illness is 10 times more likely to be the victim of violence than someone without a mental health condition. On top of that, of all the violent crime committed in the U.S., persons with mental illness comprise only 3% of all of those crimes. So it is very, very rare for someone with a mental illness to act out in an aggressive or violent way. How mental illness is portrayed in the media also has a significant impact on persons coping with mental illness themselves. Research has repeatedly shown that fear of stigma is one of the most common barriers to treatment, alongside cost and access to mental health professionals. So the fear of being judged by others, or the self-stigma around mental illness, is just as powerful a dissuasion from seeking treatment as the cost of therapy or having access to therapy. Based on the available research, it appears that games are following the same pattern as TV and film in how they represent mental illness, as inaccurate, exaggerated, and perpetuating harmful stereotypes. But because there is so little research, and because existing research has relied so heavily on film and television tropes to identify and analyze mental health representations, the full state of mental health in games is unclear. Previous research has spent a lot of time and energy trying to categorize mental illness in games using categories that were established for film and television. For example, of all video games, 70% of mentally ill characters in those games fit the homicidal maniac trope. Think Hannibal Lecter or The Shining, for example. However, 20% of portrayals in video games could not be put in a category, and that's a really large amount of representations to be othered and undefined. And thinking back to earlier in the presentation, that 25% of characters, that paper actually only looked at characters and did not account for other mental health portrayals, such as sanity meters, psychiatric hospitals, and language like depressed, OCD, or psycho. It's important for us to capture this full spectrum of mental health representations before we can begin to analyze them. In order to do that, I have developed a spectrum of psychopathological representations in games, which is a title I'm hoping to get maybe a little bit snappier in the future. To do this, I developed the dimensional representation of psychopathology in games. And I based this spectrum approach on the mental health disorders in the DSM, the diagnostic manual for mental health professionals. The goal of the spectrum is to provide a standardized framework for researchers to identify and analyze mental health portrayals in games. The spectrum features 3 main clusters of dimensionality, 1, 2, and 3-dimensional representations of mental illness in games. So we'll start with 1-dimensional representations. 1-dimensional representations are broad references to mental illness wherein the representation is a non-essential element to a character, story, or environment. 1-dimensional portrayals acknowledge that mental illness is something that exists in the world, but only through passing reference. So, for example, this is Heimskr. He's a Nord priest in the Elder Scrolls game Skyrim, and he preaches outside the keep in Whiterun, which is a very popular city in Skyrim. And he is regarded by the townsfolk as being mentally ill. NPCs in the city actually refer to him as being quote-unquote crazy. Labeling Heimskr as crazy is not essential to any aspect of the game, and if it were never alluded to at all, nothing would change. So this is a way of signaling there's something odd or off about this person because we're calling him crazy, but it really doesn't have any more deep meaning than that. Another example is the mental illness in name trope, wherein characters' names presuppose the presence of a mental illness, like the psychos from Borderlands, Crazy Red from Animal Crossing, New Leaf, and the disturbed suspect from L.A. Noire. Naming these characters does nothing in terms of the story or character development, other than signal to the player that there is something odd about the character or the situation, and could be removed without anything related to the character, narrative, or setting being lost. However, 1-dimensional does not inherently mean bad or negative. For example, an NPC could mention in passing that she went to therapy, or perhaps when searching a house, a player could find a prescription for psychiatric medications, or a psychiatrist's business cards. These kinds of neutral, non-stigmatizing references may even be helpful as they normalize the presence of mental illness and its ephemera in mundane everyday life. Next up are 2-dimensional representations. And these are portrayals of mental illness and psychopathological features that are essential to or are a defining element of a character, story, or setting, but they lack any kind of depth or dimensionality. In other words, the game does not attempt to explore mental illness beyond the very surface level. For example, in Final Fantasy VI, Kafka, the game's main villain, is motivated to destroy the world solely because he is quote-unquote insane. Similarly, Vaz Montenegro from Far Cry 3 and Makarov from Call of Duty Modern Warfare also have extreme violent tendencies and delusions of taking over the world, and it's all attributed to this very vague idea of insanity. This psychopathology that they have is core to who they are as characters, and if you removed it, they wouldn't be characters anymore. They would just be, a hollow shell of a character. There's nothing deeper going on. Similar to 1-dimensional representations, though, 2-dimensional representations are neither inherently good or bad. For example, Sandal from Dragon Age Origins appears to have a cognitive impairment that renders him pretty much mute, and it's strongly implied that Symmetra from Overwatch is on the autism spectrum. These characteristics are important to each character's identity, in Sandal's case, or personality, in Symmetra's case, but these components are not explored, questioned, or discussed. Yet they're critical to who these characters are and what they can do. It's crucial that these kinds of neutral representations can be included in assessments of mental illness representation. Otherwise, researchers may overestimate the percentage of portrayals that are over the top or that propagate negative stereotypes, or just the easiest to identify and categorize, which tend to be the ones that are the most extreme and exaggerated. These representations also serve as a model for game developers on creating characters with mental illness symptoms in a neutral or non-stigmatizing way. And last up are 3-dimensional representations. 3-dimensional characters, narratives, and environments are more than just plot points or convenient backstory. They are essential and fully realized components. These representations have depth and dimensionality and examine the experience of mental illness from multiple perspectives. For example, 2 prominent games that do this very well are Hellblade: Senua's Sacrifice by Ninja Theory and Town of Light by LKA. Both games feature character, narrative, and environmental representations of mental illness and deliver thoughtful and emotionally engaging stories that explore the depths of mental illness without stereotype, sugarcoating, or being mental health tourism. Both games also draw extensively from real-world sources. Hellblade was developed in cooperation with mental health professionals and individuals who had experienced psychosis or voice hearing, so experts by lived experience. And Town of Light is based upon historical documents and places. Three-dimensional representations do not need to be true to life in terms of narrative or design, but they do need to reflect authentic experiences. Neverending Nightmares and Night in the Woods are two great examples of this. Neither game is realistic in terms of graphic fidelity to the real world, and the story told in each of these is fictional, but the gameplay creates both the cognitive and emotional experiences that are multidimensional, complex, and reflect an experience that is authentic and genuine. So all this to say, to bring this to my goals and hopes and dreams for this framework, I want to be able to capture all the ways that mental health is portrayed in games. And so researchers have a standardized foundation for collecting, sorting, and analyzing portrayals of mental illness in games that is unique to games. Games are not like other mediums, and they really deserve their own framework and foundation. I also want to raise awareness about how common it is that mental health and mental illness issues appear in games and the casualness with which it's often treated. Raising this kind of attention can do a lot to help stem stigma or confront those kinds of stereotypes that are so common throughout all media. And last but not least, I want to help game devs think critically about their decisions to include mental health representations in their games. So this is not to say that every portrayal has to be a three-dimensional representation. Skyrim wouldn't be a better game if it included a side quest that involved going into Hemsker's psyche and background to really understand where this idea of insanity comes from. But it is useful for game developers to think in this context so they don't shortchange representations of mental illness when it arises in their games. It is totally acceptable to have a one- or two-dimensional portrayal, but having this on the spectrum gives developers a framework for creating non-harmful portrayals by encouraging them to ask themselves, does this serve our purposes without propagating harmful stereotypes? And that's it. Thank you so much.